Hello, madam. We will start with after the 5 minutes. We will wait for the speaker as well as our participants. Madam, we will begin within a 5 to 7 minutes. Hello.
Okay. Okay.
Hello, good afternoon to everyone, and welcome back again after the completion of a lunch break. So, our the next plenary session is delivered by the Miss Jinal Tandel Madam, and for introduction of the our next resource person, I would like to invite Miss Disita Parmar, Assistant Professor in Department of Pharmaceutics and Pharmaceutical Technology, Assistant in Indira College of Pharmacy. Over to you, Madam.
Thank you, sir. Good afternoon, everyone. It is my privilege to introduce our next speaker, Miss Jinal N. Tandil, ma'am, who is an esteemed assistant professor in the Department of Pharmaceutical Chemistry and Analysis at Induka Kuala College of Pharmacy from CVM University. She has received her BPharm and MPharm from QA from the Gujarat Technological University and pursuing her PhD from CVM University. She has about 9.6 years of teaching experience and 13 master students successfully completed their research work under her guidance. Ms. Jinal ma'am has received grants from different government body and has organized 10 different seminars, webinars and refresher course as a coordinator and co-coordinator. She also invited to deliver an expert talk in different workshop, pharma refresher courses and seminars. Also delivered talk in guest lecture at another institute. She also invited as judge in various state level competitions. She has published 34 research paper in national and international journal of repute. Ms. Jinal ma'am has attended various conference, FTP seminars and webinars. Madam has also participated in paper presentation and oral presentation in different national and international conference and seminar. She is a life member of APTI. Madam has also received certificate of merit from ANCROM. She got award of excellence as reviewer from the Journal of Pharmaceutical International. She has also taken hands-on training on various instruments like HPLC and HPTLC. Today, she will enlighten us on vital topic of the role of pharmacists in contagious disease management. Please extend a warm welcome to Ms. Jinal and Tandil as the she takes platform to deliver her insights. Take over to you, ma'am.
Thank you, Disita madam, for such a nice introduction of mine. Sir, can we start the session?
Yes, Madam, we can proceed with our session.
Okay, okay. Is my slide is visible?
No, ma'am, there is a still it's a black screen. Yes, ma'am, it's a visible.
Okay, okay, okay.
But
Good afternoon, everyone. Today my topic is role of pharmacists in contagious disease management, organized by the University College of Pharmacy and sponsored by Gujarat State Pharmacy Council. So contagious disease is nothing new for all of us. એવું કહીએ કે ચેપી રોગ અલગ અલગ કારણોથી ફેલાતો રોગ આપણે એવું કહી શકાય. તો એવા કયા કયા ડિફરન્ટ ડિઝીઝ છે અને એઝ અ ફાર્માસિસ્ટ હાઉ વી કેન મેનેજ this communicable disease or contagious disease. So, basic introduction will start with the basic introduction of contagious disease. Different type of the contagious disease like respiratory infection, intestinal infection, arthropod-borne surface infection, sexually transmitted disease, and different roles and responsibility of the pharmacist. So, starting with the definition, contagious disease is an infectious disease that can spread from person to person through direct or indirect contact. Direct contact means touching someone who has infections. Indirect contact means touching contaminated objects. Other ways like droplet connection, like inhaling the droplet from cough, sneeze, or talk an infected person. So chances are there we can infected by that person. Different types of ingestion, like consuming contaminated foods or water, that are the also different reason for the contagious diseases. The different communicable disease are there, like respiratory infection or intestinal infection, arthroborne surface infection, and sexually transmitted disease. Starting with the respiratory infections. So, respiratory infection can spread, like this is the kind of infection disease that affect upper or lower respiratory tract that can be caused by bacteria, viruses, or fungi. So first, chickenpox. Chickenpox, that is the disease which is caused by the virus varicella zoster. Nowadays, chickenpox is not highly occurs because we can say preventive vaccines already. We already take this vaccine to the children. Different symptoms like fever, appearance of rash on tongue, face and limbs, lesions filled with the coughs. So it is the highly contagious viral infection that cause the itchy rash with fluid-filled blisters. અછબડા જેને આપણે કહીએ છીએ સૌથી પહેલા નાની નાની ફૂંસી જેવું થાય છે અને લાલ કલરની હોય છે પાણી જેવું ભરાય છે અને પછી એ ફૂટે છે. So this is the chicken pox. Different mode of transmissions from person to person by droplet infection. Virus enter into upper respiratory tract. Contamination from the discharge from ruptured lesion of the skin. એક વખત કોઈ ફૂંસી ફૂટી જાય અને એનાથી બીજી જગ્યા ઉપર લાગે કે પહેલા ફેસ થી સ્ટાર્ટ થાય ચેસ્ટ ઉપર then whole body પર એ અસર કરે છે. Vaccine, that is the best prevention for the chicken pox. Next is measles, જેને આપણે ઓરી કહીએ છીએ. That is the highly contagious viral disease that spread through the air, and causative agents is RNA peromaxovirus, or we can say the rubella virus. Mode of transmission from person to person by droplet infection. Virus enter into the upper respiratory tract. The portal of entry is the respiratory tract or rarely conjunctiva. So different symptoms contain the nasal cataracts, like mucus જે બિલ્ડઅપ થઈ ગયું હોય એરવેઝ ની અંદર કે જેનાથી સ્ટફી ઓર રની નોઝ ના ચાન્સીસ વધી જાય છે. Sneezing, redness of eye, appearance of rash on trunk, face and limbs. These are the basic symptoms. Prevention is achieved an immunization rate of over 95% and ongoing immunization against the disease through successive generation of the child. A single dose of 0.5 ml reconstituted vaccine is given subcutaneously. That is the vaccine is the another we have the option. Next disease, that is the influenza. That influenza, also known as flu, is highly contagious viral infection that affect the respiratory system caused by the influenza virus A or B and C. Mode of transmission from person to person by droplet infection. Virus enter into the upper respiratory tract, and the portal of entry is the respiratory tract. So there is a different symptoms like sudden malaise, like એવું ફીલ થાય કે સારું નથી લાગતું, ડિસ્કમ્ફર્ટ જેવું ફીલ થાય છે, બીમારી એવું ફીલ થાય કે હવે હું બીમાર જ છું, like illness ફીલ થાય તમને, and lack of the well-being. That are the symptoms of the influenza. Causative agents, influenza virus A, B, C. Prevention is there is a medication available apart from the vaccine is amantadine and remdesivir. Diphtheria. Diphtheria is the bacterial disease that affect upper respiratory tract and can cause serious health problem if it's not treated. It is occur by the agents Corynebacterium diphtheria. Symptoms contains the anterior nasal, facial, and laryngeal. Mode of transmission from person to person from the droplet by talking with someone or by sharing the infected materials. So this is the mode of transmission. Prevention contained the treatment. Diphtheria antitoxin prepared in hot serum is given in a dose of 10,000 units intramuscularly. Another is pertussis, that is also known as the whooping cough. That is caused by the bacteria Bordetella pertussis. It is a mode of action from again person to person, and it is the symptoms contain the in respiratory tract produce inflammation and necrosis of the mucosa. Running nose is the also symptoms. Mild fever can also arise in this disease, It is characterized by the severe cough that lasts for weeks or months. In the prevention, vaccine, DPT vaccine is given to the patient suffering from the pertussis disease, and treatment contain the erythromycin, ampicillin, cotrimoxazole. Tuberculosis, one of the widely spread respiratory infected disease. We all know about this tuberculosis. Many of the time, what happened कि ખાંસી થતી હોય તમે neglect કરતા હોય તમે ટેસ્ટ ના કરાવો અને ચાન્સીસ આર ધેર કે તમને ટીબી થઈ શકે છે. It is the bacterial infection, usually affect the lungs, but can also affect other parts of the body if timely treat તમે ના કરો તો. It is the causative agents, Mycobacterium tuberculosis. Mode of the transmission is person to person, spread into the air while sneezing and coughing. Symptoms are coughing, sputum, sneezing, fever, chest pain. That are the at that time જ્યારે રાત્રે સુઈ જાઓ, at that time you feel sweating in the tuberculosis. Prevention is NTP and DTP, that is the National Tuberculosis Program, and district tuberculosis program that must be adapted to the need of community, and BCG vaccine. Treatment include the various drug first line treatments, second line treatments, and different drugs are rifampicin, isoniazid, ethambutol, pyrazinamide. These are the different. Many other treatments are also there for the tuberculosis. Next disease is swine flu. Swine flu that is caused by the type A influenza virus that affect the pigs. So it is basically spread from pigs to human and through direct or indirect contact with pig saliva, urine, feces, or scratches and bite of the pig. So it is also spread through contaminated food or water. Symptoms include the coughing, sputum, sneezing, fever. These are the different symptoms of swine flu. Treatments gives the oseltamivir drug that we can prescribe for the swine flu. This all about the respiratory disease: chickenpox, measles, influenza, diphtheria, pertussis, tuberculosis, and the swine flu. Next infection, that is the intestinal infection, occurs by the parasites. First is the amoebiasis, જેને આપણે સાદી ભાષામાં અમીબા કહીએ છીએ. It is the parasitic infection of the intestine caused by microscopic organism Entamoeba histolytica. It is a mode of transmission by fecal oral route and take place through contaminated water or food. Flies, cockroaches, and rodents act as the vector. Prevention, it is prevent contamination of food, water, vegetable, fruits, etc. And various treatments available for the amoebiasis, that is the metronidazole, diloxanides, etc. Another intestinal infection, that is the asclerosis, that is the parasitic roundworm infection caused by the asclerosis lumbricoides. Mode of transmission is by fecal oral route and take place through contaminated water or food. Prevention, prevent contamination of food, water, vegetables, fruits. Symptoms include the abdominal pain, diarrhea, dysentery. Many of the time it is spread through the parasites eggs, or this Asclerosia is spread by the parasite egg, while amoebia is spread by the parasite cyst. That is the difference between these two diseases. Treatment include are metronidazole and diloxanide. Next is poliomyelitis. Nowadays એટલું બધું પોલિયો જોવા નથી મળતું. પોલિયોનું આપણે બેઝિકલી પ્રિવેન્શન લેતા હોઈએ છે. સો વેક્સિન લેવાઈ જાય છે, ડ્રોપ્સ અર્લી એજ ની અંદર આપી દેવામાં આવે છે, જેથી પોલિયો આપણે એવું કહી શકાય કે હવે નથી કોઈને રહ્યો. So it is the causative agent by poliovirus. Mode of transmission by fecal oral route is the main route of spread. It also spread through contaminated finger, water, milk, food, flies, and other articles of daily use. Symptoms are person feels pain in the neck and back, and may also fever can also be arise in the polio. Hepatitis, that is the disease of liver inflammation that can be caused by variety of virus, chemical, drug, alcohol, or genetic or overreactive immune system की તમારી immune system weak હોય તો પણ થઈ શકે છે તમને. Hepatitis are basically caused by the agent hepatitis A and B. Symptoms include the fever, headache, joint pain, weakness, losing your appetite, pain in right side of the abdomen, and vomiting. Treatments are there is a prevention. We can say personal and community hygiene. Hepatitis A and B vaccines can be given to prevent the hepatitis. Next disease, that is the cholera. Cholera is the disease occurs by the Vibrio cholera causative agent is there. Symptoms: severe diarrhea, weakness, abdominal pains are there, vomiting, you feel dehydrated, and muscle cramp. Sometimes you feel. Mode of transmission from fecal to oral route in the main route of spread. It also spread through contaminated finger, water, milk, food, flies, and other articles of daily use. ટ્રીટમેન્ટ કવર્સ ધી રિહાઇડ્રેશન જેટલું પણ રિહાઇડ્રેટેડ થવાય ઓઆરએસ લીંબુ થી તમે થઈ શકો છો. Tetracycline is the drug, erythromycin, clotrimazole, that is the different types of drug that can prescribe in the cholera disease. Next is typhoid. Typhoid is the caused by the Salmonella typhi agents. Symptoms are you feel fever, high fever for 3 to 4 weeks. Also face the bradycardia. Prevention is typhoid vaccines are given, personal and community hygienes are maintained. Treatment is tetracycline, erythromycin, clotrimazole, that are the various type of drugs that are prescribed by physician to treat the typhoid. Next is hookworm, that is the intestinal blood feeding parasitic roundworm that cause type of infection and also known as the helminthiasis. That is the causative agent. Main causative agent is Encyclostoma duodenum, and the various symptoms include the abdominal pain, anemia. These are the symptoms for the hookworm. Prevention is typhoid vaccine is given to prevent this disease. Different another medicament that prescribed like mebendazole, albendazole, parental, etc. Next is plague. Plague is the arthropod-borne infection, that is the infections caused by the bite of an infected arthropod like mosquito or tick. So there is a bacterial disease that can affect human and other mammals also. It is caused by the this plague is caused by the Yersinia pseudotuberculous pestis. Positive agent is there. Mode of transmission through the bite of an infected flea or by handling an infected animals. So person can feel plague. Another symptoms of plague like the fever, headache, joint pain, acne, vomiting, weakness. So if any infected bite of rodents or animals, person can suffering from the plague. Different treatments are tetracycline, clotrimazole, streptomycins are the different treatment, and we can prevent this control of plague by the different DDT and BHC. Next is malaria, high fever, back pain, then muscle pain, enlargement of your spleen, bloody stools, fatigue, skin may fever, sweating, dry cough in the lung. That are the different symptoms of malaria. It is caused by the mosquito, that are the falciparum and vivax, that are the main causative agents of malaria. It is spread from the Plasmodium geminocytes to first infected mosquito, then bite to the person, then occurs the liver infection in that person. So infected the red blood cell, one flies bite to that person, and also second infection mosquito is there, and second infected person is there. So that is the mode of transmission in the malaria. Different medicament available for malaria, that is the chloroquine and pemaquine. Next disease, that is the chikungunya. Chikungunya is the viral disease spread by the mosquito that cause fever, joint pain, then vomiting, you feel back pain, headache, nausea, sometimes rashes are also there, acne is also there. That is the two types of transmission, we can say Aedes aegypti and Aedes albopictus. That is the mosquito transmittant chikungunya to the human, transfer from mosquito to humans. Different prevention, we can prevent prevention of man or vector contact by using repellent, protective clothing, mid nets, etc. So mosquito repellent we can use રાત્રે સૂતી મચ્છરદાની use કરી શકાય. બીજા ઘણા બધા મોસ્કીટો પ્રોટેક્શનના ક્રીમ્સ એન્ડ જેલ્સ અવેલેબલ હોય છે, એ પણ યુઝ કરી શકાય છે. Treatment include the intravenous fluid are needed. Platelets infusion is required in case of decreased the platelet count. કે જ્યારે platelet ઓછા થઈ જાય તો platelet infusion require હોય. Main તો rehydration is must require in this kind of disease. Next disease, that is the filariasis. That is the parasitic disease caused by the thread-like worm that are sprayed by mosquitoes. Filarial parasite. Mode of transmission, the worms are transmitted to human through the bite of an infected mosquito. If mosquito is infected, then bite to the person and person feel the filariasis. Symptoms include the swelling, skin rash. That in this filariasis, severe swelling are there in legs and other body parts. Treatments are diethyl carbamazine, that is the medicament prescribed to treat the filariasis. Next is rabies. That is the surface infection, and it is a fatal viral disease that affect the CNS and can be spread to humans and pet through an infected animal's bite or the scratch off from the surface area. So it is transmitted from the bite of the animal, virus entered by the biting to human, and then the virus is replicated in the muscle at the site of the bite. Replications are there, and virus infected nerves in peripheral nervous system move by the retrograde transport. Then virus travel from the brain via the nervous system. So brain is infected in this rabies system. Various symptoms include the nausea, fever, headache, diarrhea, runny nose, fear of water, muscle cramp. That are the various symptoms are occurs in rabies disease. Prevention, patient is isolated in a quite dark room. So sometimes what happen કે they are sensitive to lights. થોડી પણ light આવે તો એ લોકોને નહીં ગમતો. So they are isolated in the quite dark room. Muscle relaxants are given, intravenous fluids are given, and anti-rabic vaccines are given. Treatment includes diethyl carbamazine. Next is trachoma. That is the bacterial infection that affect the eyes. Symptoms are redness of eyes, there eye pain is there, swelling eyelids is there, roughening of the inner surface of the eyelids. So pain in eye you can feel. It is a leading cause, one of the leading cause of blindness worldwide is trachoma, and that is positive agent is Chlamydia trachomatis. That is the main causative agents for this surface infected trachoma. It is in the mode of transmission in we can say the contact with eyes, eyelid, nose, or throat secretions of an infected person. Eye seeking flies, contact with formalities such as towels or washcloth, handkerchiefs. કે જે કોઈ ઇન્ફેક્ટેડ માણસ હોય જેની આપણે ટોવેલ્સ કે હેન્ડકરચીફ યુઝ કરીએ, એ લોકોના ઓબ્જેક્ટ યુઝ કરીએ અને પછી તમારો હાથ indirectly તમારા eyes કે nose પાસે જાય તો chances are there કે you have that trachoma disease. Next disease is tetanus. So tetanus is a serious bacterial infection that causes muscle spasm and breathing difficulties. Various symptoms include the painful muscle spasm, especially in jaw and neck. Mode of transmission, Bacteria basically enter the body through an open wound. જે વાગ્યું હોય તમને ક્યાંક ત્યાંથી ઓપન જગ્યા ઓપન જખમ કહીએ ત્યાંથી બેક્ટેરિયા એન્ટર થાય છે. And that wound is contaminated with dirt, animals or human excreta. વારે વારે ટચ કરતા હોય, ડસ્ટ લાગી જાય તો વધારે સ્પ્રેડ થાય. It is in the tetanus you may feel difficulties in swallowing, uh, painful muscle stiffness through a body, also headache or a seizure can also are the symptoms of this tetanus. Prevention is active immunization with tetanus toxins કે કશું વાગે તો આપણે ટીટીનું ઇન્જેક્શન લઈ લઈએ છીએ. That is the best prevention of tetanus. Treatment is benzodiazepine, penicillin. Penicillin beta-lactam containing drugs that we can give to tetanus patient. Next is leprosy. Leprosy is the also called as the Hansen's disease. Is a chronic infectious disease caused by the bacteria, Mycobacterium leprae. It is the affect the skin, nerves, eyes, upper respiratory tract. Symptoms include the loss of sensation in affected area, thickening or enlarged nerves, muscle weakness are there, numbness or tingling in the hand, feet, arms, and sometimes legs are there. So transmission through close and frequent contact with droplet from the nose and mouth of an untreated person. If any person have suffering from leprosy, and if it is untreated, so their chances are there okay, from their droplets from nose and mouth are create the problem for like act like the transmitter for the another person. That is the next is sexually
Hello, hello, hello,
hello.
hello, madam. Your voice is breaking.
Okay, okay. લાસ્ટ સ્લાઇડ કઈ હતી ક્યાં પહોંચ્યા હતા લાસ્ટમાં બીકોઝ મારું કનેક્શન લોસ થઈ ગયું હતું.
ઓકે મેડમ, સ્લાઇડ છે એક વખત કન્ટિન્યુ કરો ને એટલે સ્ટોપ કરી દઉં. કારણ કે તમારી જે અવાજ
ઓકે
બી ક્રેક
ઓકે
થતો રહ્યો છે વચ્ચે.
ઓકે just give me a second. I just reconnect the laptop. Okay.
ઓકે મેડમ.
Could I say, is it visible?
Yes, ma'am, your screen is visible, but keep it on a slideshow mode, presentation mode.
Uh,
Yes, ma'am. From
has
this
it?
slide, it's not visible.
Apne slide is visible?
Yes, now slide is visible.
Okay, okay. Um,
Last one is a leprosy, and you are going to start with a sexual transmitted disease.
okay, okay. Then first, that is syphilis is the first sexually transmitted disease. Okay.
Okay, madam, you can continue.
So, okay, okay, okay. So, sexually transmitted disease is basically occurs by the sexual intercourse is the most common route of infection. And if person is having the multiple sexual partners, then this sexual transmitted disease can occur. Prevention is treat the patient for complete cure and rehabilitations, interrupt transmission of infections, use condom correctly and consistently during the sex. Treatment is protein penicillin is there. Another sexually transmitted disease is gonorrhea. Symptoms in gonorrhea is painful urination, pus-like discharge, pain or swelling in testicles, abdominal or pelvic pain, sore throat, joint pain. These are the reason or sorry symptoms of the gonorrhea. In the man, the symptoms are swelling or redness in penis, pus-like discharge from the penis, painful while urinating. The prevention in the gonorrhea is always there is use the protection at the time of the sex. Don't have sex with someone who has an active infection. So openly, someone can talk about this sexual disease. So another person can be cured having this sexual disease. Treatment is procaine, penicillin, ceftriaxone, gentamicin. These are the various medicaments can be prescribed in the gonorrhea disease. AIDS is AIDS, that is another disease. Causative agents is human immunodeficiency virus. Mode of transmission is unprotected sex with an infected person, staring the needle with infected person if a person has facing the disease AIDS, and if contaminated needles are used to the cure person, then another person is also having chances that suffering from the AIDS. Infection from the blood products are also there. If mother is having the AIDS disease, then chances are there fetus are contaminated with the disease. In the prevention, same as the gonorrhea and syphilis, multiple sexual partners are not at the good choice. So use your partner wisely. Use the protection at the time of the sex, and get tested for different sexually transmitted disease. Different treatment written away on the treatments available for the AIDS.
Yeah. Hello, sorry to disturb you, ma'am.
About the different infected disease.
Hello, sorry to disturb you, madam, but
Sorry,
your voice is cracking. Hello.
voice is cracking.
Yes,
Internet is
madam.
internet is full, but just a second. Just a second. Okay.
Yes, ma'am. Yes, ma'am, your slide is visible.
Okay. My voice is clear.
Yes, ma'am. Keep your video off. So if there is any network issue, so it can be minimized through the video offing.
Sorry.
Keep keep your camera off and then continue with your lecture.
My video camera is off.
Okay, madam.
Okay. Okay. So that's all about the various infected diseases. Now, what are the role and responsibility of pharmacists to stop, to prevent this contagious disease? So, reducing the spread of disease, advocating the prudent application of antimicrobial drugs, and educating medical personnel, patient, and the general public. So, આપણે કહી શકાય કે ઓપનલી એના વિશે વાત કરવી જોઈએ કે ડિફરન્ટ સિમ્ટમ્સ જે છે એ કઈ ટાઈપના હોઈ શકે, ડિફરન્ટ સિમ્ટમ્સ ના ઉપરથી ખબર પડે કે કઈ ટાઈપનું ઇન્ફેક્શન થયું હોઈ શકે, અને જેથી કરીને પ્રિવેન્શન ઇઝ બેટર ધેન ક્યોર. સો જે પણ ઇન્ફેક્ટેડ ડિઝીઝ હોય તો એના માટે જેટલા બી પ્રિવેન્શન હોય છે એ આપણે ફોલો કરાવવા જોઈએ. સો બાય ગાઈડિંગ ધી પેશન્ટ, આપણે જે બી પેશન્ટ હોય છે, પર્સન હોય છે, એને વેરિયસ પ્રોટેક્શન અને પ્રિવેન્શન ના થ્રુ આપણે એને સ્ટોપ કરાવી શકીએ છીએ. બીજું કે એન્ટીમાઇક્રોબિયલ ડ્રગ્સ. So various antimicrobial, bacterial, viral drugs are there જે routinely persons લેતા હોય છે. Nowadays yearly એટલા બધા નવા મોલેક્યુલ આવે છે because બોડી જે છે એ પર્સન એટલા બધા એન્ટીબાયોટિક, એન્ટીવાયરલ ડ્રગ લે છે કે રેઝિસ્ટન્સ પાવર પણ એટલો જ માઇક્રોબ્સ નો આવી જાય છે. સો યરલી એટલા જ અમાઉન્ટ ની અંદર નવા મોલેક્યુલ્સ આવે છે. તો એવી રીતે આપણે એડવોકેટ કરવા જોઈએ, એ લોકોને એજ્યુકેશન પ્રોવાઈડ કરવું જોઈએ, એ લોકોને અવેર કરવા જોઈએ કે rationally use of drug we can ऐसे કે rationally આપણે એને યુઝ કરવો જોઈએ. Okay. Reducing the range of infection. Pharmacists should take part in initiative to prevent or limit the transmission of infections among patient, healthcare provider, and the others. So, how we can contribute to cure, to prevent the contagious disease. So, as a pharmacist, આપણે કેવી રીતે contagious disease ને spread થતો અટકાવી શકીએ છીએ કે એ લોકોને જે પેશન્ટ ના થ્રુ આપણે ઇન્ફોર્મેશન પ્રોવાઈડ કરાવીએ, જે હેલ્થકેર પ્રોવાઈડર હોય છે એમને આપણે પ્રોવાઈડ કરાવીએ ઇન્ફોર્મેશન. Being an active member of an infection control committee, the infection committee control committee is there. એના તમે મેમ્બર બનો, તો તમને રિગાર્ડિંગ પ્રોપર નોલેજ પણ એન્હાન્સ થશે અને જેથી કરીને તમે બીજાને એ નોલેજ સ્પ્રેડ કરી એ લોકોને અવેર કરી શકો છો ટુ સ્ટોપ, ટુ પ્રિવેન્ટ silly disease. Giving guidance to the healthcare system on the choice and application of suitable sterilant, disinfectant and antiseptic. એવી અલગ અલગ કેટલા બધા માર્કેટની અંદર ડિસઇન્ફેક્ટન્ટ, એન્ટિસેપ્ટિક્સ આર અવેલેબલ, સર્વેલન્સ આર અવેલેબલ. સો ડિફરન્ટ ડિસઇન્ફેક્ટન્ટ હેઝ ડિફરન્ટ રોલ. તો એ લોકોને એવી રીતે આપણે ચોઇસ પ્રોવાઈડ કરી કે પર્ટિક્યુલર ઇન્ફેક્શન માટે પર્ટિક્યુલર ડિસઇન્ફેક્ટન્ટ યુઝ કરવા જોઈએ, નહીં કે એક માટે બધા અપ્લાય થતા હોય. So by providing the knowledge to the healthcare system, we can do that. Setting up internal pharmacy policies, practice, and quality control program to avoid the tainting medication made in or given out by pharmacy division. અલગ અલગ પોલિસીસ બનાવીને ક્વોલિટી પ્રોગ્રામ કરીને તમે એને અવેર કરી શકો છો કે ડિફરન્ટ ડિફરન્ટ જગ્યા ઉપર, ડિફરન્ટ ઇન્સ્ટિટ્યુટ્સ ની અંદર કે ડિફરન્ટ વિલેજીસ ની અંદર તમે પ્રોગ્રામ કરી એના વિશે ઇન્ફોર્મેશન સ્પ્રેડ કરી શકો. Offering guidelines for how frequently dressing other intrusive device, intravenous pads or monitoring equipment should be changed. The different guideline કે કઈ રીતે તમારે ડ્રેસ અપ હોવું જોઈએ, how to avoid wash your hand frequently, cover your mouth at a time of sneezing. So different IV admission stats and equipment કે જે proper sterile હોવા જોઈએ, જે use કરવા જોઈએ, contaminate ના હોવા જોઈએ. So by using such kind of the prevention, we can એક એવી ગાઈડલાઈન આપણે બહાર પાડી શકીએ કે જેનાથી પર્સન પેશન્ટ્સ જે હોય કે જનરલ પબ્લિક જે હોય એ લોકો અવેર થઈ શકે. Advising sterile items and multiple dose sterile product container to be properly dated, labels and stored. પ્રોપરલી સ્ટરાઇલ હોવા જોઈએ બધા તમારા જે ઓબ્જેક્ટ હોય છે એ એનો પ્રોપર લેબલ હોવું જોઈએ, ડેટ ટુ ડેટ ઉપર એનું ચેકિંગ થવું જોઈએ, સ્ટોરેજ હોવું જોઈએ. Creating the recommendation for the risk assessment, management, and monitoring of patient and healthcare professional who have come into contact with people who are infected with an infectious disease that is transmission. By chance કે તમે કોઈ ઇન્ફેક્ટેડ પર્સનના કોન્ટેક્ટમાં આવો છો તો તમે કઈ રીતે પોતાને પ્રોટેક્ટ કરી શકો જેથી કરીને તમને ઇન્ફેક્શન ના થાય. તો એના જે પ્રિવેન્શનના અને ક્યોરના જે અલગ અલગ મેનેજમેન્ટનું જે કીટ હોય તમે એ પ્રોવાઈડ કરી શકો અલગ અલગ પર્સન્સને અને હેલ્થકેર પ્રોફેશનને. Assuring that the quantity and type of antimicrobial agent provided are suitable for the patient group treated by working within the pharmacy and therapeutic committees. જે બી હેલ્થકેર પ્રોવાઈડરની અંદર પર્સન્સ વર્ક કરતા હોય કે થેરાપેટિક કમિટીઝની અંદર હોય તો પ્રોપર એન્ટીમાઇક્રોબિયલ એજન્ટ્સના યુઝ થાય છે કે નહીં એ ચેક કરવું જોઈએ. કે ઘણી વખત શું થાય છે કે વધારે પડતો એક્સેસ લોકો યુઝ કરતા હોય કે માઇનર સિમ્ટમ્સ માટે પણ એ લોકો એન્ટીમાઇક્રોબિયલ ડ્રગ્સ લેતા હોય છે. તો એ ના થાય એનું ધ્યાન રાખવું જોઈએ કે એનું સ્ટોક પ્રોપરલી મેનેજમેન્ટ હોવું જોઈએ કે કયા પેશન્ટને કયા એન્ટીમાઇક્રોબિયલ પ્રિસ્ક્રાઇબ થવા જોઈએ. બીકોઝ દરેક ઇન્ફેક્ટેડ ડિસીઝ માટે સેમ પ્રિસ્ક્રિપ્શન ના આપી શકાય કે ડિપેન્ડ્સ કે કોઈ પર્સનને કોઈ ડિસીઝ થાય છે, કોઈ સિમ્ટમ્સ આવે છે, એ ફિઝિશિયન પાસે જાય છે અને એને ચેક કરશે પ્રોપરલી અને સિમ્ટમ્સ પૂછશે અને એને ખબર પડશે ડોક્ટરને કે કયા ઇન્ફેક્શન થી એને આવા સિમ્ટમ્સ આવે છે, તો એ કઈ ટાઈપનું ઇન્ફેક્શન છે, કયો ડિઝીઝ છે, પછી એ પ્રિસ્ક્રાઇબ કરશે કે એને કયું એન્ટીબેક્ટેરિયલ એન્ટીવાયરલ ડ્રગ્સ આપવાની છે. તો એનું પ્રોપર આપણે એશ્યોર કરવું જોઈએ કે જે પ્રિસ્ક્રાઇબ થાય છે એ જ મેડિકમેન્ટ અપાય છે. Promoting interdisciplinary cooperation within the healthcare system to guarantee that the therapeutic, experimental, and preventative application of antimicrobial drug produce the best possible patient outcome. Based on the symptoms, જે બી ડ્રગ પ્રોવાઈડ થઈ છે વિથ ધ મિનિમમ સાઇડ ઇફેક્ટ એ મોનિટરિંગ કરવાનું હોય. ઘણી વખત એટલા બધા પેશન્ટ્સનું હોય છે કે ઘણી વખત એ લોકો પ્રોપરલી ડોઝ કમ્પ્લીટ નથી કરતા કે હવે થોડું સારું ફીલ થતું હોય તો એ દવા લેવાનું બંધ કરી દે છે. તો એ ના થવું જોઈએ. એના માટે આપણે પેશન્ટ એટ અ ટાઈમ ઓફ જ્યારે બી તમે એને ડ્રગ આપો છો તો એ લોકોને એ રીતે કાઉન્સલ કરવાનું હોય કે દવાનો ડોઝ પ્રોપર એ લોકોએ કમ્પ્લીટ કરવાનો હોય તો રેઝિસ્ટન્સના ચાન્સીસ આપણે એને રિડ્યુસ કરી શકીએ. Creating and running the multidisciplinary ongoing antimicrobial monitoring program that evaluate patient outcome to determine the efficacy of antibiotic guidelines across the entire health system. કે એન્ટીમાઇક્રોબિયલ્સ ડ્રગના યુઝ માટેની એક ગાઈડલાઈન આપણે બહાર પાડી શકીએ કે જેનાથી એનો પ્રોપર યુઝ આપણે એડ્યુકેટ કરી શકીએ કે કેટલો યુઝ કરી શકાય છે અને કઈ ટાઈપનું તમે એને ફોલો કરી શકો છો. Creating and studying quantitative data on the use of antibiotic in order to do pharmacoeconomic analysis. Educational activities, ડિફરન્ટ ન્યૂઝલેટર છે કે અલગ અલગ પેમ્પલેટ્સ છે, એજ્યુકેશનલ ફોરમ્સ છે, ડિફરન્ટ વેબસાઇટ પણ જનરેટ કરી શકાય કે જ્યાં આગળ તમે તમારું નોલેજ શેર કરી શકો છો. એન્ટીમાઇક્રોબિયલ યુઝ છે, એના રેઝિસ્ટન્સ છે કે કઈ રીતે અલગ અલગ પ્રિવેન્શન સ્ટરિલાઇઝેશન છે એ પ્રિસ્ક્રાઇબ થતું હોય એવી રીતના તમે અલગ અલગ પ્રોગ્રામ અવેરનેસ પ્રોગ્રામ કે ન્યૂઝલેટર તમારા નામથી આપી શકો છો. Informing and guiding impatient patients receiving ambulatory care and patient receiving home care કે જે લોકો હોસ્પિટલાઇઝ હોય કે હોમ કેર કરતા હોય એ લોકોને પ્રોપર તમે ઇન્ફોર્મેશન પ્રોવાઈડ કરી બાય એની પેપરમાં કે કોઈ જર્નલની અંદર કોઈ પેમ્પલેટ થ્રુ તમે અવેર કરી શકો છો પર્સનને. Participating in public health education and awareness program that promote the adult and child immunization access and appropriate infection control practices. પબ્લિકની અંદર એવી અવેરનેસ ફેલાવી જોઈએ કે વેક્સિનેશન પ્રોપર ટાઈમ ટુ ટાઈમ થવું જોઈએ લોકોનું. એવા અલગ અલગ જે પબ્લિક હેલ્થ પ્રોગ્રામ થતા હોય એમાં પાર્ટિસિપેટ કરી શકાય. તમારા જે આઈડિયાઝ હોય, જે કોન્ટેજિયસ ડિઝીઝ ને સ્ટોપ કરવાના, ફેલાતા અટકાવવા માટેના જે અલગ અલગ ગાઈડલાઇન્સ હોય એ તમે એની અંદર શેર કરી શકો છો. Antimicrobial stewardship program. So, antimicrobial stewardship program, that is a system of measure to improve the use of antimicrobials such as antibiotics. So it is the one kind of system કે કેટલો યુઝ થવો જોઈએ અને patient including emergence of resistance, adverse drug events and the cost. Antimicrobial stewardship can play a key role in the reduction of infection. પ્રોપર ગાઈડલાઈન હોય તો પ્રોપર ડોઝ, રૂટ ઓફ એડમિનિસ્ટ્રેશન ની અંદર મેન્શન કરેલું હોય, સો વી કેન સે કે રેઝિસ્ટન્સ તમે રિડ્યુસ કરાવી શકો. ઇવન યુઝ ઓફ ધી એન્ટીમાઇક્રોબિયલ ડ્રગ્સ એ પણ આપણે મિનિમાઇઝ કરાવી શકીએ. Implementing successful stewardship program involve multiple strategies, administrative support and effective collaboration of a multidisciplinary team. There is one article also published entitled The Expanding Role of the Antibiotic Pharmacist. So, ની અંદર એક particularly એક ID pharmacist કરીને appoint કરવામાં આવે છે. That ID pharmacist is infectious disease pharmacist, particularly infected disease ના જ drugs ઉપર કામ કરતા હોય એવા pharmacist કે જે લોકો antibiotic, antimicrobial drugs ઉપર જ કામ કરતા હોય છે. So એક એવો એક અલગથી જ એ લોકોને અપોઇન્ટ કરવામાં આવે છે. So they educate the all grade of health worker, co-worker and help to develop the different policy કે જે બીજા બધા health community ના જે workers હોય એ લોકોને educate કરતા હોય regarding the infected disease. Benefit of dedicated antibiotic pharmacies by reducing medication error. Sometimes similar names થી પણ error થવાના chances હોય. Reduce length of hospital stay, encouraging oral medication, ensuring appropriate drug choice. So these are the different benefit કે જેનાથી આપણે એને reduct કરાવી શકીએ. Active professionally and presenting technical strategies we can utilize to minimize the infected disease. Here are the two types of ID trained pharmacists and ID clinical pharmacists. ID trained pharmacists are the pharmacists who has received formalized training in infectious disease pharmacotherapy, and the clinical pharmacists that are the one who practice in the collaborative care of patients with infectious disease. So by in the this ID clinical pharmacist responsibility include the clinical service, research and education. Direct student ને કોન્ટેક્ટ કરતા હોય, ફાર્મા સ્ટુડન્ટ્સ ને, પેશન્ટ્સ ને જે લોકો ઇન્ફેક્ટેડ ડિઝીઝ થી સફર થતા હોય, જે ઇન્ટર્ન્સ હોય એ લોકોને જોડે એજ્યુકેશન પ્રોવાઈડ કરે, રિસર્ચ કરે કે મેઇનલી જે બી રેઝિસ્ટન્સ આવતું હોય તો નવા નવા મોલેક્યુલ્સ બનાવવાની રિસર્ચ ના રિક્વાયરમેન્ટ્સ હોય. So resistance surveillance, pharmacoeconomics analysis, that are the responsibility of the ID clinical pharmacist. In the clinical service, pharmacotherapy or pharmacokinetic evolutions, drug information or patient education regarding antimicrobial therapy. So these are the various programs, various services. So one ID clinical pharmacist should take place. And the potential shortcomings, there is the pharmacy degree only provide basic training in microbiology. It is likely that further training such as residency program, fellowship in practice, master infection management for pharmacists is crucial. Basically, pharmacy degree ની અંદર microbiology and basic biotechnology education provide કરવામાં આવે છે. But જે further enhance knowledge કરવાનું હોય કે જે અલગ અલગ program through કે fellowship through external બીજા program કે internship through one can gain their knowledge about the infected disease. Continuing training while in post and close lessons with an infection specialist to whom complicated case can be referred. એટલે વેરિયસ કેસ સ્ટડી કરીને પણ એ લોકો અલગ અલગ એક પેમ્પલેટ બનાવી શકે છે કે જેથી કરીને ઇન્ફેક્ટેડ ડિઝીઝ નું આપણે મિનિમાઇઝ કરાવી શકીએ છીએ. So patient education, counseling, educate the patient about the nature, transmission, and prevention of contagious disease. That is the responsibility of pharmacies. Various medication management is also there. Prevention and health promotions, early detection and referral, like public health role, infection control in pharmacies, emergency treatments is there. Collaborative with the healthcare team. કે કોઈ બીજી હેલ્થકેર ટીમ જોડે તમે કોલાબોરેશન કરી એન્ટીમાઇક્રોબિયલ્સ નું પ્રોપર ગાઈડન્સ પ્રોવાઈડ કરી શકો છો. So moreover, agreement with the advice again given by the consultant in charge of the patient is vital to give the pharmacist credibility with junior medical staff and will allow them to make greater contribution in the future. Another joint opinion paper is there regarding the infectious disease, that is the a recommendation for training and certification for pharmacists practicing mentoring and educating in infectious disease pharmacotherapy. So basically, infectious disease ની ઉપર proper training program, certificated programs ચલાવવામાં આવે છે જેથી કરીને pharmacist પહેલા practice કરે છે, એ લોકો અલગ અલગ case study લર્ન કરે છે અને જે બી પ્રોબ્લેમ્સ આઉટકમ્સ હોય છે એના વિશે એ લોકો શીખે છે. પછી એ લોકો એવા પ્રોગ્રામ કરે છે કે અવેરનેસ ફેલાવે છે અને પ્રિવેન્શન ઇન્ફેક્શન ડિઝીઝ થી આપે છે. Expanded competency for ID trained clinicals that make empirical, prophylactic, and definitive antimicrobial treatment recommendation based on the patient specific factor. Patients ની અલગ અલગ symptoms, age, back history એના ઉપરથી અલગ અલગ antimicrobial treatment prescribe થતી હોય છે. Interpret and make treatment recommendation based on microbiology report કે જે બી laboratory report હોય એના બેઝ ઉપર અલગ અલગ treatment એનું જે ઇન્ટરપ્રિટેશન આવે છે એના બેઝ ઉપર અલગ અલગ ટ્રીટમેન્ટ એમને પ્રોવાઈડ કરવામાં આવે. Interpret and make treatment for formulary recommendation based on antibiogram or microbiology data and critically evaluate and apply infectious disease literature and research. So basically, in the infectious disease, pharmacies play a crucial role in the management of this contagious disease, or we can say communicable disease, by providing essential healthcare service, supporting public health initiatives, and ensuring patient safety. That is our primary goal in to protect the contagious disease. So this is all about my presentation. Kunal sir?
Hello.
Yes.
Yes, ma'am.
Yes, sir.
Hello, Disita madam. Okay. Well, there is a one question from the audience.
Yes.
Uh, what is the reason behind the sweating in tuberculosis, particularly in night?
Okay. Night sweat, that is the common symptoms in tuberculosis, as I already told you, because body's infection level is very high in the tuberculosis. So that is the disease that can affect the lungs, bones, gland, nervous system. So night sweat can occur due to the number of possible reasons, like sometimes decrease in the cortisol secretions, or body secretes the less cortisol at night, so which can lead to the night sweat. So I think that is cortisol, that is the hormone that suppresses the fever and modulate the immune response. So high infection level at night sweat, that is the main reason I can say that.
Okay, madam. And there is no another question from the participants, and
Hmm?
so we can conclude our session. Thank you, madam, for sharing such a valuable and informative session on the contagious disease, specifically for a particular different diseases, which we are considering the different types of the contaminations or the contagious or make up people aware about what type of the contagious disease can be aware. So it's a such a very informative session from yours, and thank you, madam.
Okay, thank you so much, sir.
The participant can leave the meeting, so they have to join the another session link for the another session within a 5 minutes. Within a 5 minutes, we are going to start with our next plenary session or the last session for the today's.